Hi everybody, my name is Judy Xu, Chinese medicine nutritionist from Oriental Balance. Today I'm extremely happy to have Dr. Susan Jamieson to be here with us. She is the renowned integrative doctor practicing both in Hong Kong and UK. Hi Dr. Jamieson.
Hi, thank you for inviting me to talk.
This is the most colorful clinic I've ever been to. Any special reasons?
It's quite calm in here, it's green, but outside it's bright orange. Well, it's a place of wellness, not illness. And I don't want that, that's frightening clinical look, if you know what I mean, where you think you're going to get bad news from a doctor.
Yeah, I know that you are the doctor for many famous stars. For example, Elton John, Mick Jagger, and so on. How come? What brings them to you?
Do you know, I really don't know. I think God sends them in because they just find me in all different ways. However, I think they like the fact that I do Eastern and Western, and I really do mind, body, spirit. So I as a doctor, try and extend myself and do as much as I can for the patient, and they like that.
Wow. And I know that one of your specialty is stress management. I think those stars, they often at high pressure. So how you actually help them to manage the pressure and always on top of their game?
It's so hard. I mean, I think Hong Kong's just a good training field for this because, everyone here is the same as those rock stars. They're flying all around the world. Yeah. They're having to perform. When you get to a foreign country, you get to a meeting, you're jet lagged, you're maybe not eating properly in hotels, you're isolated, not with your loved ones, and yet you're having to be on the top of your game. So I think Hong Kong people have a lot in common with those rock stars. I think Hong Kong people are rock stars.
You as a doctor, you've trained conventional Western doctor. I know you trained in Scotland and later Harvard Medicine School.
I did. A strange combination.
Yeah. So what brought you into this integrative journey?
Good. I had asthma myself, and it was in the 90s in Hong Kong, and it was really, I think it was all stress-induced, to be quite honest. But I got very good Western medical treatment, best advice. And I was on all these inhalers, and then this lady just fixed me. She fixed me basically by doing some healing on me, and I was really impressed. So my asthma went, and I got acupuncture at that time, and I realised how much these therapies could do, rather than me having to take all the medications. As I see it as a Westerner, it's obviously a huge area: Eastern medicine, Ayurvedic, Chinese, the basics. With thousands of years of history. So they're complete sets on their own of complete therapies. But as a Western doctor, I see it as adding on to my own Western knowledge. So why not treat people in the Western way, but also add on the benefits of all the other ways? There's no reason not to. They're not conflicting. As an example, in Chinese medicine, they have this way of seeing the world. Maybe things are damp and heaty. The body is damp and heaty, the sort of environment of the body. And then when you go into the damp, hot summer, the damp, heaty conditions and the damp, heaty people are going to get worse.
Yeah, especially in Hong Kong.
Right, because it's so damp and hot. So I believe with damp conditions, things like bananas and mangoes and dairy is very damp. Now I know in Western medicine that all these children with mild asthma or recurrent ear infections, if you stop the dairy, the problem goes away.
Yeah.
As simple as that. So there obviously is a connection with the food and what we eat, and the same in Indian Ayurvedic medicine.
What will be the top 3 suggestions that you will give to them so that they can improve their health?
Right, well the top one is look at their minds. I mean, this is the most difficult, that's why it's the top one. Their negative thoughts, their worries, all my friends are getting cancer type thing, and the fear that goes on, right? Yeah. And you've heard this too, a lot of people nowadays, young people getting cancer. But don't buy into the fear. That's one thing. Because I have observed that people who focus on things tend to get what they focus on in all sorts of different ways. So we don't want to focus on negativity and illness. Secondly, your diet is vital. Just can't get too many superfoods and green vegetables. And I'm thinking what the third one would then be, because these are so important, those two. But it has to be, I mean, I like to move my body. I see it as moving the energy in my body, moving the chi. And so whatever form of exercise you can actually do and enjoy is, whether it's dancing, yoga, or qigong, or going to the gym, but whatever you can do and enjoy on a regular basis, your body needs to be moved. You know, we are machines that need to be kept well oiled. If we sit still, we will rust.
Thank you very much, Dr. Jamieson. Thank you for your great advice and the exercise you demoed to us. Wish you a nice day.
Thanks, nice to speak to you.
Thank you.